Welcome, welcome, welcome. This is the Health Talk Show. I am your host, Pastor G, and I'm excited about this month's Health Talk Show. So, this month, we are going to be talking about healthcare insurance literacy, which means that there's people who may have an idea about their health insurance. They may be new to health insurance, or they have known about insurance for some time because they've been using it for many years and may or may not know some tips that I'm going to share. So, this episode, if you are an entrepreneur, a business owner, this is for you as well. Because if you are a business owner and you decide to have insurance for yourself or one or two or five employees, you want to be able to know a little bit more about insurance, health insurance. But if you're someone that is retired and you are not using insurance anymore, you still want to be able to tune in so that you can share this message with those that do have insurance. So this episode is about having some understanding. Maybe I can share with you some tips that I have been helping people with. So come on into the live here. Come on in and tag, like, and share so that the people that follow you can be able to get some pointers, some tips for themselves or for their family members. You know how it is that people, get stuck with a bill and may not understand their rights. They get stuck with a bill and don't understand why. And so I want to be able to share with you some myths that people may say. I want to be able to share with you some tips and some things to ask so that you could be able to be more confident when you go to the doctor, when you'll feel more confident when you get your EOB, which we'll go into because some people right now may say, what is an EOB? So these are some terms that you will start to hear when you have your insurance. And so for those of you who just started in the marketplace, you're just fresh out of college, you now got your first job, and now you have a decision to make in regards to choosing a plan that may help you, or there's someone who is now about to go into open enrollment, which open enrollment typically is about September, October, November, December, but this is a show that could be able to help you make a right choice in that. This show is dedicated towards your health overall, but June's episode is about healthcare literacy. Now, for those of you who are new to the Health Talk Show, I'm your host, Pastor G, and we have been doing this for 2 times. And so if you want to catch up on the previous episodes, please go to our YouTube page, the Health Talk Show YouTube page, and catch up on the very first episode as I share my background. I share why I started the Health Talk Show. I shared how I got into health and how my experience in the marketplace has shaped me to start this talk show. And the second episode is a great one. I had an expert on that shared about nutrition, fitness, and wellness. So you don't want to miss those. Just go back to our YouTube page and look at the replays. So now that I basically said the intro of this show, you may hear some things that are familiar to you in the beginning, but again, this show is hitting different people at different times and different seasons in their life, different eras in their life, different times in their life, that I want to go over and share. So one of the comments or one of the statements I want to say is that many people lose money simply because they don't fully understand how to use their health insurance. We want to be able to change that. And that's one of the tips, because you can you can start a new job and they can automatically enroll you in their health care plan, or you have a choice to choose what health care plan you want to choose for yourself, and not understanding or knowing what is all involved in your health plan can hinder you, period. But it also can have you spend more out of pocket, just because you don't know. And so I want to be able to share with you my experience, with giving you some insight. Now, my experience is coupled with not only marketplace, but just my own personal journey. But I've been helping people, hundreds of people, even thousands of people, over the years, helping them save money. And so they'll come back to me and let me know that they, thank you for the tip, or they'll call me and let me know that what was suggested helped, and they now have a fuller understanding of how their plan works. So I've been working with people in this industry for over 7 years. So I want to be able to just share with you some of my knowledge. And it doesn't matter if you have a PPO plan, if you have an HMO plan, if you have an EPO plan, if you have a POS plan or open access plan. All of this knowledge will hit you wherever you are, whichever plan you have. It works pretty much the same. And yes, and yes, and yes, I know that people out there may say, oh, our country needs to change the healthcare system. Our country needs to have a universal health insurance. Or people may say that, another country has it best, but I get all that. I understand that this country's insurance may be a little challenging. You may have, a pushback with certain things, but I'm giving you knowledge about our country's insurance to help you navigate the healthcare system. Because I get it, there could be a better way of having care for your needs, but I am not here to try to rewrite the system. I'm working within the system to help you push past the blockage that may be there when you get care, or things you didn't know. So with that, healthcare literacy is an ability to understand and use health insurance, information to make decisions that save money and improve your well-being. All right, so I want to be able to talk about that a little bit. I want to be able to go right into some myths that people may say, or you may have heard. So, common health insurance mistakes and how to avoid them is the segment that I'm on. One of the myths that I hear often is, once I pay my premiums, which is the money that you pay out of your paycheck to even have insurance, the myth is, once I pay my premiums, I don't have to pay anything else. Have you heard that before? Or people that are new to insurance may have said this before. But I want to be able to break that understanding, because when you pay your premiums to your employer, that's giving you access to the plans that they have available for you to go and get care. You have to understand that your plan may have a deductible that you have to meet first before your insurance kicks in. And so that's the part that people get a little confused on, because they say that, hey, I paid my, I paid my premiums that I pay every month out of my paycheck. That should give me a right to just go into anybody's office and be seen for free. Unfortunately, that's not how it works. So when you are in the market to choose an insurance plan, you want to see if you're someone that will need to go to the doctor often. Maybe you have prescriptions, that you need to get, and you often go to the doctor's office. If you're one that know that you want to plan a surgery, or if you know that you are coming into a place that you will be going to the doctor often, then you may want to consider a plan that has a lower deductible, because with a lower deductible, it'll be quick to get the insurance that your employer partners with to pay for services. Now, for those who are someone that just do preventative services, you're you're one that may not go to the doctor often, because you just do preventative things, then you may want to look at or think of using a higher deductible plan, because you're not necessarily going to go. You pay as you go. You go to the doctor, you pay. That will help with you not paying a lot out of your paycheck to have the insurance when you have a plan that has a higher deductible. And I'll get into that a little bit later, but just know that the plan that your employer is offering you might have a deductible. Now, there's a choice. There may be a plan that you don't have any deductibles, but just copays. And copays are just basically a cover charge, as I call it, or as I say, to just get care. It may be a $20, $30, $40, $50, $60 copay that you would pay to the doctor. So, for instance, a primary care doctor's copay may be $30. But if you see a specialist like a dermatologist or ear, nose, and throat doctor, that specialist copay may be 35. So you may have a plan that is just copay driven. So you want to be able to just have those questions in mind when you choose a plan, or just know that if you have a deductible that's $500, you would pay that out of pocket first before insurance pays their portion. And insurance portion is what they call co-insurance, meaning that it's a mutual exchange. It's like a 50-50 exchange, meaning that the insurance will pay their co-insurance part. And they call it co-insurance because you pay into it and the insurance pays into it, and together it equals 100%. So, for example, the insurance that you have, you may pay a deductible, but once your deductible is met, then your insurance will cover 60% of all services, and then you'll be responsible for 40. So do the math. 60%, how to get to 100? That's 70, 80, 90, 100. That's 40%. Or if your insurance pays 80% of services, you will be responsible for 20%. It all will add up to 100%. So I don't want to lose my new people. I don't want to lose people, but that's what co-insurance is. It is the part that you play and the part that the insurance pays. All right. So just know that that is something that may come as you get care. All right. So understanding how your plan works helps with you saving money, because you may want to, you may spend more and not even know that you're spending more. Okay, so with that being said, here's another myth that I've heard people say: all not using in-network providers. All doctors accept all insurance plans. And that is, sorry, that is not the case. Just because your friend's doctor, just because your friend sees a doctor and your friend recommends this doctor because this doctor is good, does not mean that your insurance covers that same doctor the same way. Let's say, for example, that your friend has Blue Cross Blue Shield and your employer has Blue Cross Blue Shield, and this doctor accepts Blue Cross Blue Shield. That doesn't mean that it's going to be the same amount that your friend may be paying a copay, right? Seeing this doctor, but this doctor may not even be in your own Blue Cross Blue Shield network. So you always want to double check. So what you'll do is, if you have a friend or a relative that tells you about a doctor, just take that information and call your insurance and say, hey, I want to go to this doctor. Can you see if this doctor is in my network? And if you have an open access plan, typically you could go to any doctor or any facility in an open access plan, but it is up to the facility to see if they accept your plan or not. So that's the difference between a PPO, HMO, and an open access plan, is that you have more flexibility when going to the doctor. Now, some employers probably will not offer open access plans, but I'm just giving you a little heads up if you ever hear that term. So we will be talking about some terms that you may hear, may not hear, and that's okay. You can always refer back to this show to hear about it. So that's a myth that I wanted to share with you, because you want to check to see if that doctor is in your network. If the doctor is not in your network, you want to check with your insurance plan to see if you have any out-of-network benefits. Some plans, you don't have any out-of-network benefits. And for those business entrepreneurs out there, for those business owners that you are thinking of getting insurance for your employees, these are the things you want to be able to consider. Do you want to offer your employees out-of-network plans, or just want to give them a plan that they have to strictly go to an in-network provider for care? So if you do have out-of-network coverage, you just want to find out what it is, because it's going to be different. Now, most plans is going to be different. Going to an out-of-network provider may cost you more, but your quality of care may be better because you had received a referral. And I've talked to so many people where they've gone to an out-of-network provider because the quality of care is spot on, or it's a family doctor, or it's someone that referred them to them, and they want to go, and they don't care what the out-of-network benefit is. They're just going to go. So I don't want no one on here to feel like they have to be restricted to stay in network, but just know that you may pay a little bit more for that care. All right. Hopefully I haven't lost nobody yet. And this is just the surface. If you feel like what I've covered so far and at the end, and you still have questions about what I talked about, or you want to go deeper, just give us a shout out, inbox us, or send us a request in our email as well, which we will put into the chat, our email, so that you will be able to get your questions answered from me, a expert in my field of helping people in care and health insurance. Okay. So let me go to another myth that people tend to say at times. skipping preventative care. Many preventative services are covered at 100%, but the myth that people have is if my doctor orders it, my insurance will cover it. That's not the case. Now, when it comes to preventative services, you have mammograms, you have, your annual exams, you have vaccinations, you have all of these things that you could go to the doctor and get seen, and then you can and then the insurance will pay for these preventative services. One of the things you want to be able to find out if you don't know, what are my preventative services? What can I get that's covered at 100%? And you'll be surprised by the things that are covered. So some people just automatically think that, something is covered because it's part of you go to the doctor and go to a preventative service. Let me throw a tip in here for you. So I've seen this happen more than one time in me working with patients one-on-one. And again, I have worked with patients one-on-one for many years. And one of the number one things that I hear is that I went for my preventative service, but I got a bill. So why did I get a bill if I went to my preventative services? Well, here's a tip. If you go to get preventative services, you make an appointment for your preventative service and you tell the doctor, I'm just here for my preventative service. I'm here just for that. One tip that I want to say to you, if you just want your preventative services, is say just that. Because here's what the doctor's going to do. So what's going on with you? How have you been feeling? Have you been experiencing any discomfort, any pain? And if you begin to explain that, yes, I've had experienced some pain or discomfort, then they have a right to investigate what that pain or discomfort is. And then that can change the appointment to a diagnostic appointment. And then they can be on the hunt to figure out what's wrong with you. And then they can, prescribe medication or a x-ray or something to get to the bottom of your issue. And so it's a difference between a preventative service where you go in and get checked and you get an annual exam. And there's a difference between you saying you have a problem or issue, because they're there to help you, right? But it's going to change. It's going to change. And so what I've seen over the years is that two things can happen. One thing is that they can bill you or bill the insurance for the separate services that you received that was part of the issue you had. Or they bill the diagnostic and forget about the preventative service altogether because it changed to a conversation now about your care in another way. So my tip for you, and this is, you don't have to take this tip at all, but if you just want what is due to you as far as your coverage, 100% coverage, just when you make your appointment, I'm here for my preventative service. I'm not here for anything else. And then when you have your preventative service, make another appointment for that issue, for that problem. It's not discouraging you from telling them your issue, but I just want to let you know, if you tell them your issue, it can turn your appointment to a diagnostic one. And that's okay. Just know that there will be some money there, because people get frustrated when they get a bill and they said they went preventative. And one of the things that you do want to do, which I'm going to get to, is your EOB. What is an EOB? Your explanation of benefits. What is your explanation of benefits? It is the statement, which is not a bill. but it's a statement that you get from your insurance company after your care. So you go to the doctor, they take your insurance information, they bill your insurance, and you get a statement. It's very important for you to be able to look at that explanation of benefits to see if they charge you for something they should not have charged you for. Because certain things, like for example, lab services, you go for your preventative service and you get labs, and you want to make sure that the doctor is only taking blood for preventative services. But sometimes what the doctor will do, unfortunately, is they will take blood and want to know your levels for vitamin D, vitamin C. They want to know your levels for this, that, and the other. And when it gets to your insurance will process the order that your doctor had put in, and certain labs are not covered at 100%. Certain labs are now considered diagnostic, and you will need to pay on that how your plan deals with diagnostic services. So just don't be so naive into thinking that it's supposed to be 100% covered, because there's different codes, billable codes that the doctor's office can put on a statement. And guess what, people? They can get it wrong. There's times that the doctor's office, the doctor that uses their billing office, puts in a wrong code, and it triggers the statement to show a diagnostic amount. So that's why it's very important for you to look at your bill, because you could dispute it. So I want to tell you that. I'll get to that in a minute. But one of the tips that I want to say in that regard is, do not throw away your EOB because it's not a bill. What comes from your insurance to you is not a bill, but what comes from the doctor's office, excuse me, is a bill. That's the simplest way I can say it, because some people get a statement from their insurance company and they're like, this is what you owe. And usually on the EOB, the explanation of benefits, there's something at the corner, either the right hand corner, left hand corner, somewhere in the middle, that says this is not a bill. And basically, what that is giving you an explanation of what the doctor sent to them. So, this is an area and time where you can catch mistakes or see what the doctor ordered. Sometimes you may not understand the codes that they use, and that's why you just call your insurance and say, hey, I don't understand this code. What does this code mean? If you don't have an understanding, and they can let you know, oh, it looks like the doctor billed you for a vitamin D test in this lab that he took. He wanted to order extra labs because of maybe a conversation that you all had. So just have that conversation before you get your labs to see what all they're trying to, get labs for you for. Providers do make mistakes when it comes to bills. So when you look at it, you can always dispute it and say, I did go for preventative services. It is going to be reviewed by the doctor's office to see if they made a mistake, or if they didn't make a mistake, they will talk to you about what they ordered. So here's a tip. If you have a bill that you are disputing with your insurance, you can always ask the billing office to put your account on hold. What does that mean? That means that, you have an issue and you're getting that taken care of, but you have a right as a patient to call the doctor's billing office to say, hey, I want to put this account on hold because this is either with my insurance, or I'm disputing this, or I'm waiting to get this reviewed or resolved. And oftentimes, the doctor's office can put your account on a courtesy 30-day hold, which means that it will not go um, in their system in the in running of days, meaning that it will stay in their office without going towards this is the second day, the third day, the fourth day that this hasn't been resolved, the fifth day, sixth day, and so on and so forth. You could put the account on hold, like it will freeze your account, so to speak, so that you could take care of things. Now, there's some doctor's offices that will not or don't have the opportunity or capability to put your account on hold, but what they can do or what they can tell you is that they have a billing cycle. So some places have, you may hear the term 90-day cycle, 120-day cycle, where it's not going to go to their collection services until that 120 days have ended. But it gives you time to dispute your case with your insurance company. They may still give you reminders every 30 days or every 15 days, but it will show you that here's the billing cycle. Let's say they have a 90-day billing cycle. It will show you 30, 60, and 90 days to show you where your account is. So you can always ask the provider, if they don't have a 30-day hold policy, then you can always ask them about their billing cycle on that very thing. So that is a tip for you. And while we're on the subject for bills, right now, I don't want someone out there to be bullied. Sometimes the billing office will try to, I don't know, I don't want to use bullying, but maybe the phrase bullying is just what I want to use right now, or a scare tactic to get you to fear that your account is going to go to collections. I want to give you some rights that you have as a patient, and I want you to just make a note of it, okay? Because there's certain things that is protected by law. So one of the things is, um, let me pull this up because I want to give you your rights, basically. So sometimes they say that you will be going into collections. Oftentimes, the company that they use for a collection agency is their in-house collection services for accounts that is over 90 days or over 60 days old, depending on their billing cycle. And they have to shift out those accounts somewhere else. And so oftentimes it's in-house. Even though they use the term collections, it gives people that scared tactic to say, I got to get my stuff together. But sometimes it's often in-house. Other times they outsource it through a third party that they use, and your account sits there because it's over 60 days or 90 days. But either way, I want to give you this tip. Okay. Credit reporting agencies, like the three big ones, cannot, I repeat, cannot report medical debts until 360 days after it has been reported to them. So even if they say your account is going to go to collections, that is their collection service that they use. They will report it to the collection agency, but the three big credit reporting agencies will not and cannot report your medical bill onto your actual credit report until 360 days have passed. That should help you feel a little relief, even if you're threatened by the billing office that they're going to send your account to collections. They can, but know that the credit bureaus cannot have a medical debt be reported on your credit report until 360 days after it was reported to them. Now, I just helped somebody there because there's people who has been feeling the pressure of paying something and they may have not paid because their account is still in dispute. Their account is still being reviewed by the insurance or by their health plan, or they have a dispute on something that they never got that extra shot. They never got that type of medication, and it's on the claim. And so it takes insurance companies at least 30 to 45 days to reprocess a claim. So while you're waiting for these things to take place, just know that that is one of your rights. Another one that happened in 2023 is that as of 2023, medical debts under $500 will not be reported at all. So even if they send your account to collections and it's under $500, it won't even hit your account at all. This is for medical debts, okay? Lastly, once any medical debts that have gone to collections are settled, they can be removed from your credit report. So even if you have this big, huge hospital bill and it's been in dispute and going on for over a year, and they have to send it to the credit bureaus. Once it is settled, it is removed off of your report. So I'm hoping that with what I just said can help you move forward and to tell people, older adults, because older adults sometimes are subject to buying into the fear and paying on something that they may not pay on. Let's move forward. Um, Not asking for generic prescriptions. Sometimes we want the name brand for medications when the generic is just as good for your condition. It's going to be a conversation that you'll have with your doctor to see if the brand name is going to be best for you. Because let's be honest, you may have a reaction, allergic reaction to something, or your body may not be able to take a generic, but that's a conversation you want to have with your doctor. But don't be afraid to find out about generics because generics can save you money. One of the myths that I've heard in the past is insurance always offers the best price for prescriptions. That's not even the case. Sometimes not even using your insurance to get medication may be the best way for you to go because you can save money. They could be able to tell you how much this medication is without using your insurance. Sometimes you do get a good deal because of the health plan that you have. You can get brand name prescriptions for $30. So that's one of the things when you are planning to choose a plan for open enrollment this year for somebody, look at what that plan offers when it comes to brand name medications. Because if you need brand name medications, then you want to find out what that plan that you may choose offers. It could be $45 that you pay for brand name. It could be $150. It may not even be in that plan. You may not even have a benefit, okay, for a brand name prescription. So you want to be able to have and find that out before you choose a plan. If you have a plan already, you can always change your plan when open enrollment comes up to look at options for you. Now, some people, they'll choose a plan and 2 months in, they didn't know or they didn't expect a deductible, or they don't feel like this was good for them for whatever reason. You and then you try to figure out if you could change it. Oftentimes, I want to say 90% of the time, you can't not change it until open enrollment comes in because there could be a penalty or something. But 10% of that or 5% of that I've seen in the past that got overturned, it was a major emergency of some type, that justified why they have to change their health plan. So I cannot say 100% that you can never change your health plan while you're in it, but that's a conversation for your HR department and you to discuss, because they would need some type of understanding what type of emergency you are experiencing and why you need to change your plan. So it's a small opening when you already chose a plan to try to get out of a plan now, unless it's a, what they call it. I just lost it. If it's a, the name just, it went out my head. If you, in other words, it could be changed if you recently got married, um, or if you got an adoptive child or just had a child. You There are certain criterias that they will allow you to change your plan after you've chose it and you've been on that plan for some months. Um, there's some options there for you, um, if that were to be your case. But just for you to just wake up one day and say, I want to change this plan because it's just not working for me, you got to come with more than that. All right. So just check with the pharmacy in regards to brand name prescriptions. One of the things you can also look into is pharmacy discount cards. Oftentimes, pharmacy discount cards you can use in conjunction with your insurance, or you want to find out if they allow that or not. Because what happens with pharmacy cards is that you could get a medication, and that medication, you could pay like 75% off for that medication using that pharmacy discount card. Places like GoodRx, it's literally a website. GoodRx is a website that is commonly used where you put in a medication to see if you can get a discount. And you can and when, if there is a discount, sometimes that's 10%, 20%, 30%. If it is a discount, you can print out the actual coupon, take it with you, and you can redeem it. Now, here are some other websites that you could check out. It's called Single Care. You can just put it in Google and you may just have it pop up. I think it's singlecare.com, but just put in Single Care in your browser. BuzzRx, Script Save, is 3 words. Script Save Well RX. So these are some other websites you could go to put in a medication to see if you get any discounts on it. And another tip I will say is, if you have a preferred medication, go to the manufacturer of it, meaning that the manufacturer website oftentimes can give you a benefit, like a big discount, because you're going directly to the manufacturer to get it. And if anybody out there that have another tip in regards to pharmacy discounts, just put it in the comments. Put it in the comments for people to utilize, because we're in this together. If you have any websites that would be beneficial to somebody, put it in the comments right now to help somebody save money. The other thing you want to do is look out for any gym discounts, free wellness visits, any mental health apps, cashback rewards, weight management services, company perks, on and on, maternity programs. Oftentimes, people don't take the time to ask questions about what they are covered for and what are their perks. But there are plenty of benefits that is just sitting there. And unfortunately, no one will voluntarily tell you nothing unless you ask. If you call them and they have, let's say, a promotion going on, or if they are promoting something, then they may tell you about this program that is new to your health plan, but oftentimes they're not going to call you out of the blue. Some people have. The company I used to work for, that's one of the things they did. They did outreach to tell, patients, here's what you have available. So I'm not saying that it doesn't work, but call and find out if you have any perks. And when you are employed, find out the employer's perks, because there could be discounts on travel, there could be discounts on entertainment, on medications and things, who knows, on massages. Some plans do not offer coverage for a massage, but the employee perks may give you a discount off of massage parlors or places like that. I'm just using that as an example because when people look up physical therapy for a benefit or chiropractic care, they oftentimes will see if massage is also part of their health plan. And oftentimes, no, but the employer perks may cover that for you. So, just as a tip, that's what you can do. Telehealth services, please utilize your telehealth services. Oftentimes it's free, where you could talk to a doctor. And one of the myths I heard is telehealth won't help. They cannot treat me over the video. And so I've heard that, and I want to say that you're not giving them a chance because there's certain things that they can do. Telehealth doctors can diagnose, they can prescribe medication, they can refer you to an urgent care or a ER depending on the situation, because they can help you save money whether you go to an urgent care or not. And most of the time it's a cheaper option. So just want to give you that heads up in that regard. So let me hurry up because I've been on here for some time. I guess I won't be able to go through all of my things I wanted to go over. But I want to share this tip, and then maybe I'll come back and share some more. An itemized bill. Basically, what you want to do is, beside the EOB, you want to ask for an itemized statement, because a hospital or a doctor's office may give you just a bill of services and you don't know what is involved in that. So an itemized statement breaks up everything. Even if you got an aspirin at the hospital, it will show you what that price was. So ask for an itemized statement. Um, and what will show on there is a breakdown of the procedure, the labs, the supplies that was used, to help you get clarity so that you won't get charged or double charged. There's certain things that happen that you don't want to get double charged for, and maybe the doctor's office put it on there. You want to be able to look at it to see if they build you something you never got. Again, like for example, aspirin, or something that you refused, and they put it on the bill anyway. You just want to just double check. It helps you to clarify everything that was done on your visit. So an itemized statement from the doctor's office is what you can ask for. And you can dispute your charges. I want to say this, I'm trying to hurry, but you can dispute a charge for something. And I want to share with you what you can do. So if you wanted to dispute a charge, I say use these 3 Ps: polite, persistence, and be patient. Um, but you can ask them, is there a way to adjust this? At times, you can review your bill from an itemized statement and see that something that you got from the doctor's office actually costs way more than you thought. And at the time, you couldn't pay it, but maybe a month later, let's say you can pay it, you can ask them for what they call a prompt pay discount. Prompt pay discount, which means that it's something that you can, they may give you a discount because you can settle that issue right then and there. So say like the blood pressure check was $275 that you got, and you ask them, is there any discount towards this particular item? And you ask them for the prompt pay discount, they may say, well, we can do $100 for this. And if you have it right then and there, you could just pay it, and that was a discount to you. So just know that that is something that you can also do. What I probably will have to do is come back again to share more tips with you in regards to insurance, because I don't want to rush through anymore and I don't want to spend too much time. But I will say this as I close: No Surprise Act. It is something that the federal, it's been passed for some years, and people kind of get confused about it because they believe that ground ambulance services are included, and they're not. What's included in the No Surprise Federal Act is air ambulances, where you are protected, you have rights, where you're not being balance billed. What that means is that the doctor bills you for the whole entire amount because they're out of network with your plan, and whatever the insurance paid on it, they want the additional amount be paid by you, but you are covered and protected by No Surprise Act. But air ambulances is a part of that. Ground ambulances, did I say that wrong? Ambulance is not included. But what is included is non-emergency services are included. So if you go to a in-network provider, a doctor or hospital, urgent care, and they're in network, but you are seen by out-of-network providers such as a radiologist, anesthesiologist, and they try to bill you for their services. You have rights where they are not supposed to bill you out of network services, like having you pay for their total bill. So look up your rights. The website is cms.org. Excuse me, let me say that again. It's cms.gov. I'm sorry. It's cms.gov is where you can read about your patient rights when it comes to No Surprise Acts and what falls under No Surprise Acts. All right. So I have shared so many things with you. I'm hoping that it will help you make some good decisions. I cannot wait for our next episode in July. We'll have a special guest on with me, and you will start seeing the flyers come up on social media. Again, it was a great time for us to be together, and I hope you walked away with some knowledge and some nuggets that can be able to assist you in your health journey. We always say stay tuned and stay connected, where you'll be able to get more tips from me and more special guests coming on. And it was a pleasure talking with you all. Once again, thank you for coming on and tuning with me on today. Thank you so much. Have a wonderful day.